Health Secretary, you said recently it's up to us to have a debate as a nation about where we go next with the vaccine rollouts, identifying priority groups. How do you identify who needs a vaccine more urgently between a police officer, a shop worker, or a teacher? And the second question, can I have your response to Dr. Tedros from the World Health Organization, who said, as far as the global distribution of this vaccine is concerned, we're witnessing a catastrophic moral failure?
Thank you. So I'll ask Susan Hopkins to come in on the first part of that question. But it is essentially the clinical advice is to go through the top 4 groups and then through groups 5 to 9, which takes you to the over 50s. And then after that, it is essentially about protecting people as well as possible, according to essentially a judgment about who we think who should come next. That's why I think we should have a debate about it, because 99% of the deaths occur in the top 9 groups. I mentioned in my opening comments, 88% are covered in the top 4, 99% in the top 9. So after that, it really is about protecting against transmission and making sure that we can get life back to normal as much as possible. Susan.
Yeah, absolutely. So just to reiterate, those discussions happen with the Joint Committee for Vaccination and Immunisations. And we look at a range of figures there. So deaths, clearly, hospitalisations next, and then transmission. And I think one of the important points is that we're learning how well, and will continue to learn how well this vaccine will protect against transmission. And that knowledge will help inform the next decision-making process. Because clearly then you may target groups that are transmitting more than others or are out there and working. If it isn't working for transmission, then I think we need to continue to target the groups at the highest risk of hospitalisation, and those are the older age groups.
Thank you. And then on the second part of your question, I was in communication with Dr. Tedros over the weekend, and the UK is the world's biggest financial supporter of the global programme to ensure access to vaccines in all countries in the world through organisations like CEPI and COVAX. So not only have we developed, in partnership with our scientists at Oxford and AstraZeneca, we've developed what is currently the most cost-effective vaccine that is available, the Oxford AstraZeneca vaccine. We've also put the most financial support into these international efforts to ensure everybody has access to vaccine. So I absolutely agree with Dr. Tedros on the importance of a global rollout, and we in the UK can be proud of what we are doing to support that happening financially. And I look forward to working with the World Health Organization and others, including in CEPI, COVAX and other organizations, to try to make sure that we get enough vaccine to be able to vaccinate the whole world, and certainly the whole world's adult population for which vaccines are now approved.